most all of our lives have been touched in some form or fashion by mental illness, and that's why we think that today's discussion is so critical to our community health in general. Back in November, our news program at KLRU, Decibel, did an entire half-hour special on mental health. And we want to begin today's discussion with one of our panelists, Karen Reynes, who is the Executive Director of NAMI Austin. And we asked her to list some of the major myths surrounding mental health. So we want to start with that. Take a look.
There are 5 common mental health myths that we just have to talk about. Hi, I'm Karen Reynes, and I'm the Executive Director for NAMI Austin. NAMI is the National Alliance on Mental Illness, and we're the local affiliate, providing all kinds of free classes and support groups for families and individuals living with mental illness. The first mental health myth is that mental health issues aren't common. The truth is, 1 in 5 people in the United States and actually globally are impacted by mental health issues every single day. It's a lot more common than we realize. And the reason we don't realize how common it is because we don't talk about it enough. The second mental health myth is that mental health issues are caused by character flaws or personality weakness.
You are entering a new world of health care.
The truth is, mental health is a public health issue. I love what the World Health Organization says, which is there is no health without mental health. These are brain health issues that impact lots of people, and treatment does work and recovery is possible. The third mental health myth is that kids don't get mental illness, when the fact is that actually mental health issues are as common among children as they are with adults. The numbers are the same, 1 in 5. And in fact, lifetime mental health issues show their signs by age 14. The fourth mental health myth is that people don't get better. The truth is, mental health treatment does work and recovery is possible. We see it every single day, and we know that the success rates are very similar to physical health issues. The right treatment, access to medication, therapy, a great support system, people can and do get better. The fifth mental health myth is that mental health issues aren't life-threatening, when in fact what we know is about 90% of suicides in our community are caused by either untreated, undertreated, or undiagnosed mental health issues. Suicide is on the rise, and so it's really important that we pay attention to mental health issues so we can save lives.
We thought that would be a good framework to start our discussion because we all want to end a lot of the myths and stigma associated with mental health issues. Before we do get started, I do want to take a moment to correct an error that was sent out in the Leadership Austin Engaged Breakfast email. It stated that 1 in 2 children are diagnosed with mental illness by age 14. The more accurate statement is that 50% of all mental illnesses occur by the age of 14. And you should have noticed an update in your most recent communication from Leadership Austin. Well, our goal at Decibel, you just saw a taste of our work there, but we are KLRU's news division, and we want to cover issues that really matter to the community, and certainly mental health is a key one. Our partnership with Leadership Austin makes total sense to us. We are often covering the very same issues that Leadership Austin is during these engaged breakfasts. We have a quick reminder for you, and that is we are live streaming on our Decibel ATX Facebook page with KLRU, so if you would like to share that, we hope you will via social media, because that's a great way to raise the awareness and raise the profile of these discussions. If you want to text in a question, We call this Engage Breakfast, and we want you to engage and ask questions. The directions are there, right there on your screen. You text the questions to 22-333. And Courtney Bailey, if you could wave. Courtney is Leadership Austin's Director of Issues and Engagement, and she will be your voice essentially this morning, taking in those questions and asking our panel members. Now I want you to meet our illustrious panel. As I said, I've met several of them and worked with them, and I think you're in for an education like no other when it comes to mental health issues in Central Texas. First, we have Karen Reynes, who you just met, and as we mentioned is the Executive Director of NAMI Austin, which is a group that really strives to transform how people view mental health in our community. Next, we have Courtney Robinson. Courtney is the founder of the Excellence and Advancement Foundation. This provides services to break that school-to-prison pipeline and create new paths for children at risk of becoming involved in our criminal justice system. And we have Michelle Pearson. Michelle is a licensed clinical social worker doing that groundwork every single day. Currently, she's working as a school-based therapist with Integral Care within the Del Valley Independent School District. Then we have Tariq Daniel, who is the founder and executive director of What's in the Mirror. This is a social movement that provides mental health awareness and suicide prevention through art and advocacy to communities of color. And finally, down on the end, we have Brandy Hart. Brandy's the Chief Administrative Officer at Seton Shoal Creek Hospital. And as many of you know, this is a behavioral health hospital that provides mental health and substance use services to both children and adults. So thank you all for giving us your time this morning. I want to begin with just a general question for everyone. And that is, what led you as individuals to want to tackle this particular community issue? That's the first thing. And then what are you hoping that everybody else out here gains from what you have to deliver today to us? So what led you to tackle this issue, and what are you hoping we gain from the conversation? And I'll just go down the line. Karen, if you'd like to begin.
Thank you, Judy. I think for me, while I have the wonderful gift of being the executive director for a great organization doing all kinds of work in the mental health field in our community, honestly, I'm here today and I've got this name tag on largely because I'm a mom. And about 8 years ago, I almost lost my own teenager to suicide. And that very much has been the driving passion to do this work. And then secondly, I think my great hope for today's conversation is that all of you walk away today equipped with great information, ideas about resources, and the inspiration to go out and have some conversations, just like Dr. Garcia talked. How do we create safe spaces for all of us to have positive and proactive mental health conversations?
Good morning. I would say what led me to this work, particularly the school to prison pipeline, is that my father was incarcerated when I was 6 months old and he was 18 years old. So I'm really impacted by youth and how they find their way into the criminal justice system. And often in that work, we find that children have experienced adverse situations and their mental health is challenged and has gone untreated, underdiagnosed, and we really believe that this work is critical and important to how we transform, how communities combat the school to prison pipeline. And the second question was?
What you're hoping we gain.
What we hope we gain. Okay, so I hope that people gain knowledge, but I also hope that you feel a call to action, that you will think about where you spend your resources and your time, and think about putting those resources and time towards organizations that are doing the work on the ground.
Great. Michelle?
Good morning. First of all, I just want to say I'm so grateful to be at the table, because it is wonderful to be doing this work and see so many people that are interested in talking about this very important issue. I think what keeps me involved with this important issue is just seeing that there is so much hope in kids. I think we're all here because we know that recovery is possible, and that despite the adversity, I think what we see a lot in Del Valley is, kids who've been impacted by trauma, issues of domestic violence, and what comes with living with poverty, and just all the challenges that they face. And families are resilient, but I think what keeps me excited about doing this work is seeing that there is hope in it, and to see the light come back in children's eyes despite what they've been through. And so that definitely keeps me in this work. And then the second part of the question, I would say just keeping this at the forefront. I think it's important, we are the voices of these kids, making sure that they get their needs met and that programs that are doing this important work are well funded, because my only wish out there is there was just more of us. Many of us are in 2 and 3 schools, and ideally we'd be in one school, and ideally there'd be more than one of us in each school because there is such a need and it is important work.
Tyreek?
Good morning, everyone. I think one of the main reasons why I got into this work and why it's important is that my little sister is a 3-time suicide attempt survivor, and I never knew. It was something that she was ashamed to talk about with our family, and that just made me really want to get into the work of awareness and in the stigma, because if my own sister was ashamed to talk to us about it, then I know that there's a lot of other people out there that's ashamed and dealing with the stigma. And what I want you guys to get out of the conversation from my perspective is just to look at mental health from a cultural responsiveness. We can't treat mental health the same for everyone. We have to be mindful of backgrounds, sexual orientations and everything else that leads to the whole person. And so that's what I really would like for you guys to get out from my perspective of this conversation.
Good morning. Everyone has a great story about how they get into their career path or field. Mine is no different, but really mine comes from a place of personal awareness. Every one of us at some varying level has their own bag of issues. Sometimes we live in a state of denial where we don't want to acknowledge it, or we're scared to talk about it. I was called in coming from a family who struggled just like everyone else, and wanting to give everyone a voice, to normalize it, to talk about it in a platform where it's not stigmatizing, and to create an environment where people can get care, personalized care, safe care, when the need arises. And so I've worked in a lot of areas to be able to deliver that both individually as a counselor and then as an administrator. What I hope you all take away is that, just like my reason for getting in, is that we all have mental health. It is a part of who we are. And I hope that by learning more about issues that our adolescents and children are facing, that you can help normalize the conversation, that you can start it at home, or be able to normalize it within yourself, and then how can you be an advocate in the community that you're in to help promote those conversations early and avoid crisis situations and really intervene.
I want to spend a little time on audience questions, but before we do, I have one kind of overview question, and that is how well our community is doing addressing these mental health incomes. Karen, do you have information on like what does the data show? How are we doing as a community? Are we doing better than most cities or not so great?
Yeah, well, I think certainly we're fortunate to be in a community where we have some great resources. You have a robust NAMI affiliate, you've got integral care, you've got a number of psychiatric hospitals, so certainly we've got some resources in our community that you might not find in others. But I think when you look at the data, what the data tells us is we are right to be concerned, and we are certainly right to want to create change in our communities. So as you saw in that video, it mentioned the fact, and you brought it up as well, that 50% of lifetime mental health issues show their signs by age 14. The follow-up to that is the fact that there is an 8 to 10 year gap between the onset of symptoms and treatment. Imagine all the things that happens in those 8 to 10 years. 70% of the young people in our juvenile justice system have some underlying mental health issue, and that's certainly not a place where they should be receiving treatment for that. We know that suicide is the second leading cause of death among ages 10 to 24, and only to accidents. It's second to only to accidents. And then we also know that in the state of Texas, in 2017, our kids reported that they had almost double the rate of attempted suicides than the national average. So there's a great deal of concern there around that, and we know that here locally, Integral Care has reported that on their crisis line where they receive calls, they've seen a 40% increase in the number of calls they're receiving needing access to help for their kids. So certainly we know that that's the case. The good news is, again, that there's I think it's important to recognize that in our community we have many of the folks sitting here on this panel and beyond who are actively engaged. There was a task force that Integral Care facilitated last year that's continuing the work of really looking at children's mental health and the crisis piece of it and how to address that. So there's a lot of good work being done in that community. Your awareness of that will be really important so you can help advocate for the kind of change and funding that is often required to make that change possible.
Anyone else have some personal observations about how well you think our community is addressing mental health outcomes for young people? Anybody else have a...
I think I know one of the things we see a lot in schools. We, unfortunately, in the last month, had a 6th grade student who died by suicide. And by the next day, many of our students knew about that via social media. So what we know is they don't have the tools to process that. And many families don't have the tools to be able to talk about that. And so I think it's really important. We do have kids that have access to information in a way they've never had before. And so helping them, making sure they have the education and tools they need to be able to make sense of really adult content oftentimes is really important. And so I think that education piece in schools with families in the community is really, really important.
Courtney, do you have some questions from the audience?
So, is it on?
That's our non-working mic.
Okay. There you are. So how do we as individuals get the leadership in the community to engage and change policy in favor of more mental health care?
Boots on the ground kind of stuff. How can we accomplish that? Anybody? Go ahead.
I think there's a variety of different ways that you can become engaged. One, it's using your voice, and there are lots of ways that you can do that. In order to use your voice, you must have knowledge to back your advocacy. So learning about initiatives, learning about the services that are offered within the community or the lack thereof, which is sometimes the case. Going to your political leaders, your school leaders, your faith-based leaders, and sharing your voice with them and advocating for those resources. Sometimes using your personal story as a means of advocacy is really strong, but not being afraid to speak out.
I would agree with Brandy in that so often I know we're doing a lot of work in schools, and sometimes parents will ask us, well, why haven't you come to whatever their school where their kids are? And it's like, well, we have to get an invitation. And the reality is we can do the outreach, but we do find sometimes that schools are resistant, and a lot of times it's that fear that if you come in and you bring the information that somehow you're going to make kids think more about mental health or suicide. And so there's a fear there. And so I know we often say to parents, you have to be the one to advocate in your local school to say, we want more resources and education and support in our schools. The other thing I'm going to challenge you to do is to get educated. And if you're talking about youth mental health, one of the best things that you can do in the next few days is go to Integral Care and search for the Children's Mental Health Task Force. And you will find this document. You may not want to actually download it and print it, but you can certainly read it online. But this is the work that the task force that Integral Care has facilitated. This is the work they've been doing. There's recommendations in here. Become educated about what the needs are and where the gaps are, and where this task force has really looked at, here's the next steps we could take as a community so that you can, from a place of knowledge and integrity, know what the gaps are and be able to communicate it well.
And I think one of the, this question is based around leadership, and this segues nicely into the, we're nearing the end of the Texas legislative session. And one of the topics they've been talking about is whether mental health services can prevent school shootings. So earlier this year, Senate Bill 10 was filed by Senator Jane Nelson, and this is a bill that would create Texas mental health care, a consortium of sorts. This is a $100 million initiative. I don't think it has long legs right now. I don't know if it has passed. Is anybody? I don't think it has. I think I would know. But what do you think about this particular bill, and in general, the question, that Courtney asked, what are ways we can, the people that are making these massive decisions about our children's lives and their mental health are, a lot of them at the Capitol building or in our city halls. How can we get that message to them?
Well, I mean, when I look at the bill and read about it, I don't see anything about mental health services. And the idea to really connect mass shootings to the work of mental health is kind of like a scary approach to me, because we already have the stigma of mental health, And so just reading over the bill, I feel like that's going to put fear into the people that's dealing with mental illness, and then the idea that mental illness is the only just the only contributing factor to mass shootings. I feel like if we really want to put that kind of money into a bill to try to reform mental health in the state of Texas, we need to do the groundwork. How can you create all these task force and all these committees in schools to talk about mass shootings, but we're not putting the same effort into mental health services? So instead of just putting a telephone in the classroom, we need to make sure that every school is doing the right work to deal with bullying, doing the right work dealing with counseling, making sure that there are not 2 or 3 people working in one, doing one person working in 2 to 3 schools. So I think the bill has is kind of tricky, and I feel like
it might lead to more stigma.
A lot more stigma, because mass shootings is a rare occurrence, and it's happening more, right? So it's not something that we should ignore, but that shouldn't be the forefront of what we're going to look at as a mental health reform in the state of Texas, in my opinion.
And I think we have to be and I think we have to be careful when we're talking about legislation. I mean, when we think about let's take Brown v. Board, 1954, we were using it to end racism. We can't use legislation to end gun violence or to deal with the issues around gun legislation. And so I think we have to be careful with this kind of legislation. So I agree with Tariq in that we can't just blanket a piece of legislation. It's really about policy and practice, and how are we doing the work in the community, and what does that look like in terms of boots on the ground and the people who are actually participating in recovery. And so services are very, very important, and so I think that having the resources and funding is important, but I think we have to be really, really careful about putting gun safety and mental health in the same basket.
Myth number 6 is that people living with mental illness are violent. The truth is that only the correlation there is about 4%, and in that 4%, what you almost always see are people who are living with untreated, undiagnosed psychosis. I think if you pay really close attention to the concerns that we have around mass shootings, what you tend to see more is issues around people who are really isolated, who've encountered bullying, which I think is the biggest issue of violence that our kids are facing every single day. We should be more concerned about that. Dating violence, another huge issue. Self-harm, another huge issue. So if you want to look at violence, those are the issues we need to be paying attention to. And then we've got to really focus on this focus on intervention and prevention and creating those safe spaces that we talked about, and making sure that, honestly, instead of hardening our schools, we need to be softening them a little bit.
Yes, and if I could add to that, I think, one of the things that we're doing in schools, in changing that culture and really making it a little more trauma-based classrooms, in the sense that we are recognizing what triggers children who have been through trauma, and we are helping teachers understand, what types of strategies to use to help it be a safe environment. I do think, we're really trying to change the culture of schools, because I think there is a lot of fear and misconception around mental health, that it's something that kind of happens off in the distance and it's scary. Where I live, which is off in the suburbs, we recently had a teacher that died by suicide, and it really rocked our community because people were just not well-versed in talking about mental health and how important it really is. So it impacted all our teachers and our students, and I felt that people just struggle for the language. And so I think it starts with us, educating ourselves. We have, a mental health first aid that Integral Care provides, where we can just even talk about the basics of how to recognize when we're concerned about people. And, we're talking to kids about when you're worried about a friend, what needs to happen, who can you go to really make sure we're kind of taking care of one another and watching each other, because it's our responsibility to care for one another. And so we're teaching on that level what to do and how to recognize those signs when someone needs support.
And after watching you in the classroom, I wish that we could just clone you and have you in every
Oh, so do I. I wish
all of the schools.
Myself and my coworkers, that's what we wish for, is more of us out there.
But that's a money issue. And I have a question for you, Brandy, because it deals with money. So what are the current trends and costs for behavioral health and psychiatric care for children? Because they've got to be rising, right?
Wow, I'm scared to open this can of worms.
That's all right. That's why we're here. This is a safe space to talk.
I'll begin with, you all are probably personally aware of the changes with healthcare and the impact that has on the family. Texas is one of the highest uninsured populations due to lack of access to affordable health care. Additionally, Texas did not participate in the Medicaid expansion plan, which changed our ability to offer additional services under Medicaid, which many children in the state of Texas are insured under our Medicaid plans. Even when you are able to be insured either through private insurance or through a state or federal plan, it's often difficult to find providers. The reimbursement for mental health services is certainly not equivalent to reimbursement even for medical care. We talk about parity, but really it's a separate but equal, not quite equal scenario when it comes to resources to fund mental health services. Because of that, many providers within the community, those that would provide those initial preventative interventions such as counseling or psychiatry on an outpatient basis, often do not participate as plan providers with the managed care plans. And so then families are challenged when resources are scarce to be able to afford to access counseling services or psychiatric services that can be preventative and work to address issues before a crisis arises. So what happens then is an individual ends up in a crisis situation and the most expensive intervention is required, and that's an inpatient hospitalization, which can cause thousands of dollars of financial burden to an already taxed family. When we talk about students or children, it's not just the child that is often in crisis, it's the family themselves facing life stressors. Certainly the child has probably already had issues that has resulted in the family not being able to work due to having the child sent home from school or being school avoidant due to depression, anxiety, any myriad of issues. And so there are already these other stressors going on with the family. So when we talk about the trends in healthcare, certainly it's growing astronomical costs to be able to provide care, lack of access to care regardless of whether you have insurance or not, and then limited resources just in general with the service levels that are provided. And so it becomes that continuous cycle of how do we access care, how do we change it, and really pushing our healthcare, managed care organizations to look at other models for care, not just fee-for-services model where they're paying for X, Y, or Z, but looking at a more holistic approach, value-based care, where you have a comprehensive package approach where they pay for that and then allow the providers to implement the services that are in the best interest of the person receiving care, and not just we're only going to pay for X, but we're going to give you this amount of money, do an assessment of what this individual really needs, and then provide a comprehensive care approach that looks at the holistic person and not just one aspect of the person's health.
So if you had a magic wand, that's what you would like to see happen.
I would love to.
Courtney, let's hear some more questions from the audience.
So earlier we mentioned like cultural responsiveness. Are there any organizations that are doing good culturally responsive training on the ground? I know you mentioned mental health first aid, but are there any models out there that should be used more that you know of? And if not,
Tyreek,
how would you design one?
Well, I would say it's definitely probably a gap in the mental health first aid training in a lot of these organizations, but I definitely think there's a lot of local organizations that's, that works in social justices. We have, Austin Justice Coalition, we have Community Healing Project, because the idea is mental health and trauma, right? We know that these things are happening around us. We know that, we have the idea and the situations where, young black men are being killed at a certain amount of rates. We know that we have the issue with deportation and ICE. We have all these things that's going on in our communities nationwide. And you have to respond to that. You have to respond with that in a mental health lens. And I feel like a lot of the organizations are doing that. Are they getting the funding to actually have the mental health training that they need? I don't think so. I don't think the money is getting, funded to them. It's not trickling down to the organizations that are doing the work on the ground. If something, if someone is getting murdered, they're responding to that, because that's the trauma. Those are the triggers. That's where the mental health aid should be in these organizations, that's responding in the communities when these tragic things happen, these mass shootings happen. So you can't just approach it from the actual mass shooting. You can't just approach it from the actual, Sandra Bland and all these other things that's impacting our community. You have to have these organizations get the funding that they need when they respond. So if we want more mental health professional aid training, we have to go to the organizations that are actually responding to the need of the community when they're going through these tragic and trauma things. So,
and I think, Courtney, this is your space. So talk about this.
So I want to add a little bit to that. Thank you, Tyreek. Some of the work that we're doing, our project is called Healing in the Village. And with that work, we are training professionals throughout the community, across different organizations, agencies, so on and so forth. And a part of that training is broad, in the sense that in January we had a huge conference. We partnered with COSBAC, which is a national organization, the Coalition for Schools Educating Boys of Color, St. David's Foundation, Austin's Race and Equity Council, with Community Advocacy and Healing Project, and lots of other community partners, because the work that we're doing really is focused on Black and brown children, and how do we ensure that they are healthy. And often one of the things that we ignore in trauma is the racial trauma that happens, that Tariq was talking about. And so we want to make sure that our focus is around race and equity, and how do we help families partner with practitioners that understand and respect their culture and their language. And so one of the events that we have coming up on June 8th is our Healing in the Village Family Festival. And so this is an opportunity for families to come out, to have fun, to eat, to great entertainment, but to also engage with healing practitioners, to see people who look like them, who understand their language, their culture, and who really want healing in our community. In the work that we do around the criminal justice system, we see every single day how we serve families. Yes, youth are referred to us, but at the end of the day, we're serving families who aren't always in crisis. We have this sort of notion that the school to prison pipeline are these horrible children that have committed these heinous crimes, when in actuality, many of the kids have been suspended for talking back to their teacher, for being out of dress code, for appearing more aggressive or threatening. And all of those things are centered around race and how we see children of color. And I think it happens in terms of mental health. We see all the time when we have a 6-year-old who is a white boy and he is aggressive in the classroom and putting pencils in the ceiling, the teacher will say things like, well, maybe he should be tested for autism. We have a 6-year-old boy exhibiting the same behavior, and teachers will say, well, I think it's oppositional defiant disorder. And so in thinking about how we handle mental health, I don't think that we can ignore the issue of race, because it's a part of all of our systems. It's like the air that we breathe. It's embedded. None of us can avoid it. I mean, no one can escape it. And so I really think we have to be intentional about including communities of color in conversations about mental health, because the stories aren't the same. They look a little differently, and they have to be responded to differently.
You know, there's another lens. It's another lens because LGBTQIA youth are 6 times more likely to experience depression and than the general population, 4 times more likely to commit suicide or at least attempt it. So, Tariq, I know that you identify as an Afro-queer mental health advocate. I want to talk about some of the unique issues that impact young people who are dealing with some of these issues.
Well, I mean, it definitely goes back to that cultural responsiveness, right? You know, 80%, what they say, 80% of LGBTQIA youth do not feel protected at school. And that's because, again, that cultural responsiveness. Like, the teachers have to treat, you know, their, you know, queer students differently. They have to respond differently to their needs, their wants, how they're raised. And same thing as parenting. I had a panel, we had a Children's Day mental health teen summit on Saturday, and one of the students was identified as queer. And the idea is the parenting, right? And the idea that we're always waiting for our queer child to come out of the closet. But is it really the responsibility of a child to come out of the closet? You know, are we responding to our children to ask them the questions that we need to know? It's 2019, and the idea of being queer is different, you know, and so I feel like a lot of times we're waiting for something to happen when we know that if your child identified in the home as queer, you might know it's time to ask those questions, because a lot of times they're in hiding. They're scared. They're going to school, they're being mistreated, and they're not telling what's going on at home. They're not safe in school, and they're silent at home. And that's what leads to that isolation, you know, and that depression, and that feeling that, you know, their life is less valued because the stigma of being queer in America still exists. The way, you know, the bullying. When we talk about LGBTQIA youth, bullying is the #1 thing. They are being mistreated in the schools because the schools does not have anything most time in place to cater to their needs, to identify if they're being mistreated in a different way. We know bullying happens, but same way when we deal with discrimination on race, we have to definitely deal with the discrimination of sexual orientation and not wait for a child to tell you that this is happening in school, or I am queer, or come out of the closet. I feel like we need to get rid of that notion of coming out of the closet. Ask your child what's going on, how they identify, you know, what is their sexual orientation or their gender identity. You know, our trans kids are killing themselves because they feel like they were born in another body, but they have no one to speak to. So if it's nothing at the school to respond to their needs, and it's silent at the home, where are our LGBTQIA youth going to? What are they doing? What help are they getting? And so they're living in this world of isolation. So the numbers make sense to me because I know that's the culture that we live in. And that's just the challenge of really parents and the schools to really start addressing, you know, I mean, it's a huge LGBTQIA population in Austin, right? It's very huge. Again, what are we doing to respond to a community that exists, have always exist, but still in this isolation phase? And so those stats, you know, are alarming. So when are we going to respond to that in some kind of way? So, yeah.
I want to segue into substance abuse and substance use because, you know, in the past, mental health was in this box and substance use was over here. They were kind of separate problems. But we now know that substance use and mental health conditions really do impact one another and kind of need to be treated together. So could you kind of expand on that concept?
Certainly. I think with any of these, we have to look at it from through a holistic lens. Medical issues, mental health issues, substance abuse issues are very much interrelated, and we can't separate them out and focus only on one aspect of a person's care. With substance use or mental illness, they're often co-occurring, meaning that it's kind of a chicken and the egg scenario. Which came first? Was the substance use related to a medical condition that became an abuse scenario? Was it I'm self-medicating because I'm feeling depressed or anxious, and now these substances are helping me cope? For a lot of people, it is a coping strategy, an unhealthy one, because they lack the other coping strategies necessary to really deal with what's going on behind the scenes. And so it is important to integrate that and do a holistic assessment. It's not necessarily just focusing on the behavior of treating the addiction, although that's part of it. You have to look at treating the why behind. And so doing an assessment, trying to understand the pieces and parts that are there, what led up to the initiation of the behavior, just focusing on the behavior. We talk about substance use addiction, but addictions in all areas, food addiction. We've all tried to go on diets before, but not always understand that what we eat and why we eat are associated a lot of times with how we're feeling. And the same goes with use of substances. So trying to figure out the why and addressing the why behind the behavior is just as important as addressing the behavior itself, and really working together. For us, sometimes we may not be able to provide the whole picture, and so it's partnering with other individuals who specialize in treating a behavior while we work on treating the other parts. It's a relationship that occurs.
And that's the next thing I want to talk about is explain to us how there are partnerships in our organization that deal with youth substance abuse and mental health. How are you all working together to attack this problem? And I'm assuming that there could be even more partnerships on the horizon that could help.
I think you're seeing coalitions in our community that are forming around, substance use disorder and the mental health piece. I know organizations like ours are very much engaged in that. I mean, here's the reality is that you had so many people on this panel. You guys noted it's like this is one of the bigger panels that they've had, and they probably could have had a few more on this panel, right? Because the reality is that mental health is complex and that no one of us has all the answers. We have to work collaboratively and support and affirm each other's work to really create any kind of change. So I think the good news in our area is that you've got coalition task force that are working together that understand exactly that. I know some of the work that we're doing is in educating both parents, teens, and school professionals to understand, especially among youth, because that's who we're talking about, that when you see a substance use issue in a young person, almost always there is some mental health issue underlying that. It can be easily seen as bad behavior, right? Here's a bad kid getting into trouble. Do not think that. That is a kid who's struggling and trying to figure out some way to deal with these feelings, these awful sense of health issues, really, that they're experiencing, that many times they don't know how to talk about with their parents, and how important it is for us to recognize that. That when we talk about one of the ways that, when we talk about the 8 to 10 year gap, that's one of the things that often happens is substance use issues. And really beginning to see that both substance use and mental health as health issues, not as behavioral issues. People aren't misbehaving, they have health issues that need to be treated. And there are treatment options out there. We just have to talk about it and address it in that kind of way.
I would say also one thing that's always very surprising, and some of the kids that we get referred, is what floats to the top is the behavior. We see aggression, or we see acting out, school avoidance. So it seems in that same way that these are kids that, just aren't performing well for whatever reason. And then once we get to know them, we realize what they've been through, what they're struggling with, what their families have been through, what their community is dealing with. The pressures of Austin and the increased cost of living. I mean, that pressure trickles down to our families. And so I think what we see, once we uncover what's really going on, it's amazing. I'm often shocked what they've been through. And so I think that piece of early intervention is so key. I've had so many kids and parents tell me, for middle school kids, it's too late. It's too late. I don't know what to do. It's too late. And I'm like, it's not too late. This is the perfect time. Because while early intervention is definitely key, I mean, getting these kids the sooner the better, but we've not lost them, And so there is a program that we have called Strengthening Families that does address just that. I wish it could be everywhere, and I wish all families would enroll, because what we see in these kids is they are substance using, they are cutting, they are thinking of committing suicide, or ending their lives, or they're thinking that there's no place in this world for them, which is very sad and dangerous to see in kids. But then this program, and it's not the answer to everything, certainly, but engages both their caregiver and this child to help them communicate and help them process some of what they've been through. And it is intensive. It's a long program. But I've seen families come back from it and really gain skills is what they need. Skills to be able to manage all the things that they've been through and they're going through that help them deal with the world in a more positive, healthy way. And so it's wonderful to see families realize we can heal from this, we can recover from this, and my kid can still be happy and successful despite what we've been through.
I think we have time for one more audience question, but Karen, you said you
Well, I was just going to say, I think Michelle points to something that is so important. There's such a focus on the schools and on the kids themselves, and I think we forget the families in the midst of all that, that parents need education and support and need that assurance that it is going to be okay and that there are safe places where they can get support and the resources are there, because so often we're leaving them out of the equation, and they need to be part of that equation to ensure that those young people move into a place of recovery and wellness, because they can.
Courtney, one more audience question.
So how do we think about and approach social media and its impact on mental health?
That's a huge one when it comes to young people. I'm sure everyone wants to weigh in on that, but it is impacting how our young people and all of us see ourselves. So who wants to talk about that hot topic of social media and mental health and what we can do?
We were just talking about this earlier. We can't shut down social media. So instead, we need to think about how we approach it. And I think it starts with conversation. I think it's important to talk with your kiddos about what they're viewing and have open dialogue and not just assume that they're only looking at those pre-scripted, appropriate, G-rated things. It's giving them information. It's having them validating it. It's doing fact-checking. It's helping them understand that social media isn't always reality. The images displayed, the stories told are the highlight reel of someone's life and not necessarily the facts. We need to make sure that we ourselves as parents, as community members, are also looking through that same lens and helping share out information that's meaningful. There are ways that social media can be incredibly effective too. In fact, yesterday I shared the Leadership Austin link with my bio about being a presenter. And I had a friend who I've known since high school private message me on Facebook and share a personal story that, and I was not aware that her 19-year-old son was struggling and was contemplating suicide. I think it's important for us to use it as a device of communication, but also be aware. It's okay to share, it's okay to communicate, it's okay to push things that are meaningful, but it's also important to know that you have to balance those things.
I'm going to push that a step further and say it's also okay to take a break. I think a lot of times we focus on youth and we say, oh, millennials or teenagers or whatever, they're so addicted to their phones, but let's own it. As adults, we are too. I constantly have my phone with me, and I think we sort of model that as well, that we get this opportunity to model it for ourselves and our youth, and to sit down and have real conversations. I sat on a panel not too long ago with a doctor who said, our communities are dying from isolation. We think we're connected because we have these devices that give us these images and we have followers and friends, but the reality is that we're human and we're hardwired for connection. We long to be in spaces together, to laugh, to hear each other's stories, and our kids need that too. We need to create spaces in our community and our families where we shut off our phones and we play games and we talk to each other and we go on walks and do all those things that all of us need for good mental health.
Wonderful.
I think we also have to consider that our children are no longer sheltered. I mean, I'm of the generation where at midnight the flag came onto the TV and we were...
I remember that too.
we were done.
And we're done.
We were done. As I have a 12-year-old and a 17-year-old, and I remember when my 17-year-old came home as a freshman in high school and said that his friend said, look at this. and on the screen there was a man being killed in live time. As a parent, as much as I can say you can't have this or you can't do this and put all of these things in place, we still have to recognize that our children are going to be exposed in ways that we can't control and in ways that their brains they're not developmentally appropriate and can't process these things. And so having these conversations, ongoing conversations about being honest with how we use social media, but also talking to our kids about, what did you see today? What interesting did you see on social media? What bad thing did you see? What funny thing did you see? Because what they may see as funny, they may have desensitized what is really something very violent and ugly and terrible. And so I think we as parents, I'm speaking from the parent perspective, we have to have more conversations with children than we've ever had to have before, because they're trying to process information that their brains are not equipped to process.
None of our brains is equipped to process some of the things we're seeing on social media. It's time for a call to action, and since you're next in line, I'm going to have Michelle, you start, and we'll come back this way. But just give our audience a short, a long-term, actionable step that we can take to improve our understanding and really our behaviors towards improving young people and their mental health outcomes.
I'm like, look at my notes, because there are about 50 things in my head that we should start with, but clearly we have to start with just a few of them. I mean, certainly coming from my perspective and thinking about my colleagues who are out there also doing wonderful work, is just resources. Being in the schools, we do see, you know, I have the luxury of not working for the school, but seeing what they go through at the same time. And it is a lot. It's a lot. There's a lot going on there. And so they don't have the tools. They don't have the resources. There aren't enough of us there. We wish there were more of us. We'd like to be seeing, you know, many more kids. I often see kids that are like, Miss, when are you going to come get me? And I wish I could. But, you know, I've got as many kids as I can see. So resources for sure. You know, putting out information. You know, we have flyers about suicide prevention, the mental health first aid. I think families are hungry for tools. I think we all need tools to help us have these difficult conversations amongst each other as adults and also with kids. And I also think, you know, finding ways to support organizations that provide mentoring. There's real healing and connection with humans. I think, you know, one of the things in working with kids is they want to talk to someone. They want someone to hear them. They want to trust others, and don't often have the opportunity to do so. So I think really supporting those organizations that provide mentoring opportunities to connect with someone who wants to sit and listen to them on their hearts and hear what they've been through, because I think that's important, and there's real healing and recovery in that. And so I would say also, you know, supporting those organizations, you know, such as ours and others that are doing that work is really important.
Tyreek?
Just going back to like the social media thing, one of the ways I would say like a call to action is what we do at What's in the Mirror, being a social movement. We try to engage with young people in the way they are engaging on social media, getting the information out about mental health and love and all that through hashtags, through challenges, through videos, through, you know, again, we know the youth is spending a lot of time on social media, and I agree with everyone's response about social media. I would love to get rid of my phone sometimes, and I would love for the youth to do the same, but we know that they're on there. So one of my main approaches is to meet them where they are, you know, try to change the narrative of mental health as, you know, I don't want to say make it cool, but make it relatable to our youth. And if that means doing a funny, you know, challenge to get the youth to understand about loving or being anti-bullying and, you know, all these things that we know that youth need, then, you know, create a hashtag, create a challenge, you know, post videos, post positive message, try to be the counter of what all the negative that we see on social media. If everyone in this room posted something positive towards mental health that was youth geared, I guarantee it will have an impact in some way to the community, you know. And so that's one way I feel like we can have a call to action. And just in general, just be culturally responsive when dealing with mental health. Everyone doesn't need the same kind of love, the same kind of attention. So if we start doing that, then we'll be able to get to the root and really expand on how we treat people in mental health.
Brandy?
I think it starts with you. Own your story, share your story, talk to others. If you don't know something, ask people. learn about things, expand your knowledge base so that you can be a support for someone else. It really is about connection. Be available to the children that may be personally yours, that you may be exposed to. Be a support system, a place of trust, of comfort for them to come if they need to share with someone. And then be their advocate in your community with your local leaders, your school leaders. Know that the squeaky wheel does get the grease, and the more that we all come together to advocate and share the message and normalize the conversation around mental illness, we're really comfortable talking about things like cancer. We're comfortable doing walks. We're comfortable wearing our pink ribbons. We need to have that same level of comfort when we talk about mental illness, that we're okay with sharing, that we're okay with promoting and advocating for those resources.
I'm a big believer that one of the reasons we don't talk about mental health is we're just afraid. We don't know how. And so you're hearing this encouragement to start conversations and to talk about mental health. So one of the things I encourage you to do today is, Jessica Miller's back there. She's our Child and Youth Program Coordinator. Raise your hand, Jessica. One of the things that we created last year that has been so successful is what we just call our conversation cards. One side gives some facts, information, warning signs, and then the flip side of the card gives you some conversation starters, how to have that conversation. Because so often, as I said, I was running into people that just said, I don't know how to start that conversation. It's also got some great resource information as well. And then we also have these cards as well, which has information about what we do on one side and our information, and then the flip side has crisis information. So suicide prevention lifeline, crisis text line. We made them business card size for a purpose so that you can carry them around in your wallet. You never know when you're going to encounter someone who might need that. So my call to action is you find Jessica and grab a couple of those cards. The other is I'm going to encourage you to continue to be engaged and keep learning. You heard a couple of times about mental health first aid. Your local mental health authority here in town, Integral Care, offers that at absolutely no cost. There's no barrier to you continuing your education. Take mental health first aid. Can't commit to those 8 hours? Come see us at NAMI Austin. We offer a 4-hour workshop called Family and Friends. I think we're doing one on May 18th. Again, no cost to that. And then we're constantly offering on a regular basis, on a monthly basis, all kinds of educational opportunities. We're also coming into workplaces. So you as leaders, if you want me to come in and have us come in and start talking about mental health in your workplace to get that conversation started there, we're happy to do that. But keep the learning going, keep the engagement happening, and start a conversation today, and then keep those conversations happening. It is the way we're going to change this.
Finally, Courtney.
I would say my call to action is Youth Healing ATX. Join the movement. You don't have to be a mental health provider. You don't have to work in this field, but it takes everyone in the community from all industries to ensure that our youth are healthy, happy, and whole, and that we're sending them into the world, into the adult world as whole people. So I would say start with Youth Healing ATX and engage, and feel free to come out and learn more and engage more and figure out where exactly your point of entry may be, and don't feel shy to engage if you're not already involved in this work. There's something for everyone. The saying is that one person can't do everything, but everyone can do something. And so as a community, I think we have the power to change this trajectory that we're on, and to really increase the amount of healing that happens with our youth.
So thank you for giving us your morning. Please help me in thanking this incredible panel who shed so much light on mental health and how we can all get involved in making our community a safe place for our young people. Thank you. Now go out and make it a great day, everyone, and try to stay dry. It's rainy out there.